The treatment for CLL is really rapidly changing, and this year's ASH is no different. So we've seen updates in the frontline space in terms of ibrutinib with the ECOG trial, which has shown last year an overall survival in favour of ibrutinib compared to chemotherapy, and that was confirmed with further updates at this meeting. We're still not sure whether there's an advantage for a certain good risk group of patients called the VH mutated patients. So we have a large trial in the UK called FLAIR, which we hope will address that particular issue. We also had a further update of the venetoclax obinutuzumab, so a time-fixed therapy in frontline CLL. And again, that looks encouraging that most patients remain in remission out at 3 years and beyond. That means 2 years after stopping treatment. So that was very encouraging. We also saw some updates of combinations, which are probably the future. So ibrutinib plus venetoclax and acalabrutinib plus venetoclax plus obinutuzumab. So quite chemotherapy-free but very effective combinations. We saw the first data for the next generation, one of the next generation BTK inhibitors, acalabrutinib, showing that that's effective in frontline compared to chemotherapy, and that has led to the approval for that drug in America, and hopefully next year it'll be approved in Europe. And then in the relapsed space, we saw an update of venetoclax rituximab, which is probably one of the standard treatments for that time in the disease, and the responses are still looking good out at 4 years. And then two more sort of new therapies. One was the reversible BTK inhibitors. So we saw a very nice bit of data with the first of those. The Loxo compound was showing that most patients who've potentially failed BTK inhibitors may respond to these reversible ones. And then finally, in the relapse space, the CAR T cells. So there was a nice presentation showing that in CLL for the first time that one of the CAR T cells seems to be extremely effective at controlling the disease, even when patients have failed an average of 5 therapies in that trial.